Greeting dear friends, today we talk about adrenal gland, physiology, anatomy, hormones, disorders, causes, sign and symptoms, examinations, treatments. What are adrenal glands? The adrenal glands, also known as suprarenal glands, are small, triangle-shaped glands that are located on top of each of the two kidneys. They're a part of the endocrine system and produce certain hormones that help regulate several important bodily functional. Adrenal glands are composed of two parts, the cortex, outer region, and the medulla, inner part. Each part is responsible for producing different hormones. Adrenal glands function. Adrenal glands are responsible for producing and releasing the following essential hormones. Cortisol. Cortisol is a glucocorticoid hormone that plays several important roles. It helps control the body's use of fats, proteins, and carbohydrates. It also suppresses inflammation, regulates the blood pressure, increases blood sugar, and helps control the sleep-wake cycle. Adrenal glands release cortisol during times of stress to help body get an energy boost and better handle an emergency situation. Aldosterone. Aldosterone is a mineralocorticoid hormone that plays a central role in regulating blood pressure and the levels of sodium and potassium, electrolytes, in the blood. This means aldosterone helps regulate the blood pH by controlling the levels of electrolytes in the blood. DHEA and androgenic steroids. These hormones are weak male hormones, meaning they don't have much biologic impact. They are converted into female hormones, estrogens, in the ovaries and into male hormones, androgens, in the testes. Androgens are usually thought of as male hormones, but the female body naturally produces a small number of androgens too. Adrenaline, epinephrine, and noradrenaline, norepinephrine. These hormones are known as the fight or flight hormones and are called catecholamines. Adrenaline and noradrenaline are capable of increasing the heart rate and force of heart contractions, increasing blood flow to the muscles and brain and assisting in glucose metabolism. They also control the squeezing of the blood vessels, vasoconstriction, which helps maintain blood pressure. Adrenal glands often release these hormones, like other adrenal hormones, when you're in physically and emotionally stressful situations. These hormones can be categorized into two broad groups. Catecholamines. Catecholamines are a group of similar substances that the body releases into the blood in response to physical or emotional stress. The primary catecholamines are dopamine, adrenaline, and noradrenaline. The adrenal medulla, the inner part of the adrenal glands, produces and releases the catecholamines adrenaline and noradrenaline. Steroid hormones. Steroid hormones help control metabolism, inflammation, immune system functions, salt and water balance, development of sexual characteristics, and the ability to withstand injury and illness. The adrenal cortex, the outer region of the adrenal glands, produce and release glucocorticoids, mineralocorticoids, and adrenal androgens, which are all types of steroid hormones. Note: many other parts of the body interact with adrenal glands, including hypothalamus, pituitary gland, kidneys, sympathetic nervous system. Anatomy. You have two adrenal glands that are located on top of each of the kidneys. The kidneys are located underneath the rib cage on each side of the spine. Both of the adrenal glands consist of two main parts. Medulla. The medulla is the inner part of the adrenal gland, and it releases the hormones adrenaline, epinephrine, and noradrenaline, norepinephrine. These hormones help control the blood pressure, heart rate, sweating, and other activities that are also regulated by the sympathetic nervous system. Cortex. The cortex is the outer part of the adrenal gland, and it releases corticosteroid and mineralocorticoid hormones. The adrenal cortex also stimulates the production of small amounts of male sex steroid hormones, androgenic steroids. Adrenal glands are normally about a ½ inch high and 3 inches long. They're shaped like rounded triangles. Disorders. There are several different adrenal gland disorders. They happen when the adrenal glands make too much or not enough of one or more hormones. Some adrenal conditions are temporary, whereas others are chronic, lifelong. Causes of adrenal gland disorders include genetic mutations, changes, autoimmune diseases, tumors, such as pheochromocytomas, damage to the adrenal glands through injury, infection, or blood loss, an issue with the hypothalamus or pituitary gland, which both help regulate the adrenal glands. Certain steroid medications, such as prednisone and dexamethasone. Adrenal gland disorders include Addison's disease, primary adrenal insufficiency. This is a rare autoimmune disease that causes the adrenal glands to produce lower than normal levels of cortisol and aldosterone. Cushing's syndrome, this condition happens when the adrenal glands produce too much cortisol. It's usually caused by a tumor or certain medications. Congenital adrenal hyperplasia, this is a condition you're born with where the body lacks an enzyme that the adrenal glands need to make hormones. Excessive hair growth, hirsutism. This condition happens when women and people assigned female at birth, AFAB, develop excessive hair growth due to high levels of androgen, which the adrenal glands make. Primary aldosteronism, Conn's syndrome. This condition happens when the adrenal glands produce too much aldosterone. Massive bilateral adrenal hemorrhage, Waterhouse-Friderichsen syndrome. This is an acute condition that leads to adrenal gland failure due to bleeding into the gland. It's usually associated with a severe infection called sepsis. Signs and symptoms of adrenal gland. Signs and symptoms that are relevant to the bodily processes the adrenal gland hormones affect include metabolism symptoms, unexplained weight gain or weight loss, fatigue, frequent high blood sugar or low blood sugar, weakness. Immune system symptoms, frequent sickness or infections. Blood pressure symptoms, high blood pressure, hypertension, or low blood pressure, hypotension. Sexual characteristics symptoms that affect females and prepubescent males, growing facial hair and or balding, developing acne, having a deeper voice and becoming more muscular. Diagnostic examination. Certain blood test. Urine test. CT scans. MRIs.